Hello, my name is Kassandra Martinez. I'm a student of Dr. Cervantes in South Texas College Division of Math and Science Department. I am in the class of Anatomy and Physiology 2402, and I will be presenting today about ovarian cancer. What is ovarian cancer? Ovarian cancer is the overproduction of cells in the ovaries, later on transforming into a tumor. Ovarian cancer is known to have a high mortality rate due to its vague and rarely common symptoms that could be also unmistakably thought of as a cold, which don't make themselves present until the later stages, making it too hard to cure. Ovarian cancer is found in the female reproductive system, specifically in the uterus. Ovarian cancer, it is not difficult to treat it once they are able to identify it. Since it is usually only attached to the cervix of the organ, the chances of survival if identified in the first stage is of 95%. Like any other cancer, ovarian cancer chances of survival decrease as more advanced it becomes, starting with a 95%, as I mentioned, in the first stage, 60% in the second stage, 30% in the third stage, and 10% in the fourth stage, which is the last one. Okay, continuing with the structure of ovarian cancer. Ovarian cancer is developed in the lateral sides of the uterus, where the reproductive system makes and stores the eggs for a successful pregnancy. The ovaries secrete two types of hormones, which are estrogen and progesterone. These are in charge of regulating menstrual cycles, making sure to prepare the body for a successful pregnancy, and helping the uterus development. There are two fallopian tubes attached to uterus where the cells or production cells travels, ending up in the ovaries forming the cancer. The most common type of ovarian cancer is epithelial ovarian cancer, which is under is the surface or outside of the cell that surrounds not only the ovaries but several other organs. This is why it is known that ovarian cancer will not only stay in the ovaries but can also travel around the body, infecting or attaching to other organs, developing a more severe cancer types. Now, I would like to oversee a case study about ovarian cancer. Ovarian cancer was diagnosed in a 54-year-old woman who came in the hospital with symptoms of abdominal inflammation, discomfort, constipation, and severe weight loss. She had a medical history of menopausal osteoarthritis, which was controlled medically, obesity, and hypertension. The doctor ordered an ultrasound sonography of the abdomen, chest, and pelvis, a cytology exam, general molecular testing, and somatic testing. The results was a 4.5 centimeter ovarian mass on her right side, adrenal mass in the lymph node on the right side, and a genetic modification of a half negative and of homologous recombination deficiency. The diagnosis was stage 3, which was advanced in the epithelial ovarian cancer. The treatment included surgery, which successfully removed majority of the tumor found in her uterus, but due to the advances of the stages, she was later she had later passed away after a year and a half of in and out chemotherapy. Now, I would like to talk about some of the cancers for ovarian cancer. Ovarian cancer, as I mentioned previously, is the uncontrolled cell division and which eventually cluster into a form of mass or tumor, which can later damage the tissue greatly and spread to other areas of the body. It is not clear what causes ovarian cancer, but it is likely due to genetic modifications or environmental factors. The risk factors include early first menstrual cycle, family precedents of such cancer, never being pregnant, not having tubal litigation after a certain age, obesity, history of breast cancer, and genetic modification. All of the above are factors that may increase your chances of having ovarian cancer or being an ovarian cancer carrier. Also, to add, the reason why never being pregnant is like one of the major reasons, because the body of a woman is, how to say it, made to be able to give birth, and the body after a certain age or during a certain age produces extra nutrients and other hormones needed for childbearing, which could be harmful for the body if you never used them or like made them get out of your body one way or another. Ovarian cancer has several symptoms that I would like to go over at this moment. A person may not show any symptoms at all until the cancer has advanced to a stage where it's not curable anymore or completely being able to remove it. Some of those symptoms may include belly pain, constipation, inflammation of the abdomen, abnormal menstrual cycles, tiredness, radical weight changes increasing or decreasing, lack of appetite, bloating, chest pressure, or problems breathing. It is important for the person in question to be aware of their symptoms and seek medical secondhand or diagnosis in order to be comfortable and make sure it's not something greater on happening. To continue, I would like to talk about some preventive measures for ovarian cancer. The best methods will be having a healthy diet, especially rich in fibers, making sure you check yourself at least once every 3 to 5 years to discard any possibility of ovarian cancer development, or to consult your family to make sure there's no such presences in your family. Having surgery to remove part of your reproduction system after you have no desire to have more future children will also help greatly help you prevent such cancer, as it will prevent the body from overproducing hormones or producing nutrients for baby when it's not needed anymore. Also, breastfeeding is greatly recommended instead of using formula. Not only helps your baby but also helps you release those nutrients or hormones that may be harmful for yourself if you keep them instead of releasing into through the lactose for the baby. Also, accumulated lactose from is really known. Even though it is an ongoing study, it is known that it may be attractive of invasive cancer cells. To continue the diagnosis process for ovarian cancer, it involves identification, consists of different tests that enable the doctor to have a broader look of the patient's insides. Some example of such tests includes an ultrasound test of the abdomen organs, specifically the pelvis, where it's the nearest located to the uterus. The magnetic resonance test allowing the doctor to have a full view of your body to make sure no cancer cells are spread anywhere else. The tomography test and the gastrointestinal X-ray allowing him to look everywhere in your stomach. And as I mentioned previously with the MRI, it allows the doctor to view that no cancer is traveling through anywhere to prevent a misdiagnosis. Treatment for ovarian cancer. The treatment main goal, of course, is to remove the cancer cells completely, but the best option for ovarian cancer is surgery, as the ovarian are usually on the outer surface. The cancer is easily removable, of course, if it's identified in the early stages before it has spread completely. There are three types of treatment that are linked together, which is first, surgery, remove the major part of the tumor and tissue that might be affected or sever a pathway to different parts of the body to prevent it from spreading any further. Chemotherapy uses the drugs and drug chemicals together with radiation therapy to kill the remembered cancer cells. And lastly, the pills, drugs that prevent the cells from dividing any longer, forming once again a tumor. As I mentioned, as the stages are in the first for ovarian cancer, it is easily removable, but it is so hard to identify it due to its commoncy in the symptoms. Doctors usually don't straight up identify stuff like cancer, so it can be a rough journey if found after the second or third stage of cancer.